So today we'll be talking about the CNS infections with meningitis as a primary point of discussion, but we'll be talking overall in terms of CNS infection. In that, encephalitis also is going to be quite important. So first of all, you need to know what do you mean by the term meningitis. Meningitis is nothing but the inflammation of the meninges and the subarachnoid space. So this is a simple definition. And most of the time, meningitis can be due to non-infectious causes also. It can be non-infective. So we have a lot of types of connective tissue disorders causing meningitis also. So that is going to come under non-infective causes. But most of the time, it's going to be secondary due to some infection, like either a bacteria, virus, fungus, or going to be a TB. So, but remember, it can be non-infective at times. This is quite important when it comes to rheumatological disorders. A lot of them can cause aseptic meningitis. And what is the clinical triad of meningism? So when you're going to really suspect that the patient is having meningitis, headache, photophobia, and or phonophobia, and neck stiffness. Some people use vomiting also, but nevertheless. So whenever you have headache, photophobia, and neck stiffness, this is going to be called as meningism. So if they ask you the clinical triad of meningitis, so clinical triad of meningitis, in that case, it's going to be fever, headache, and neck stiffness. So if you have these three, this will come under the clinical triad of meningitis. This is how actually we suspect meningeal infection or meningeal inflammation in practice. But meningism is different. Meningism is a combination of headache, photophobia, and neck stiffness. And this can occur in conditions that are non-infective also. Like for example, subarachnoid hemorrhage also can produce the same triad. So anything that irritates the meninges is going to result in something called meningism. So you have to be clear about that. And how can you classify meningitis? Meningitis can be classified as acute, subacute, or chronic. Acute means less than 1 week. Subacute means 1 to 4 weeks. And anything more than 4 weeks or more than 1 month, we're going to call it as chronic meningitis. So we'll be discussing all of them, acute, subacute, as well as chronic meningitis subsequently. So by etiological agent, it can be a bacterial meningitis, or it could be a viral meningitis, or a tuberculous, fungal, or non-infective causes also that we have discussed.